A very warm welcome to all of you. Myself, Dr. Bharti, Principal, Faculty of Physiotherapy. Today, we will be discussing about very important topic that is the part of treatment, that is vestibular rehabilitation therapy as an approach. So, what is the concept of that vestibular therapy and how it is based? It is based upon the neuroplasticity, that is the adaptation by the brain. It is the capability of the brain to recognize by forming new neuronal connection throughout the life. It allows the neurons in the brain to compensate for the disease and adjust their activities in response to new situation or to changes in the environment. Neuroplasticity is nothing but the brain adaptations. So, our VRT protocols, that are the vestibular rehabilitation therapy, based upon the concept of the neuroplasticity. Now, we must know when to give that VRT therapy to anybody and what type of the complaint that patient felt when we prescribe the VRT, that is vestibular rehabilitation therapy. So, yes, we are giving the VRT to the patients who have an vestibular impairments, who have an vestibular symptoms. That means patient has an dizziness. Patient complaint of dizziness. Patient may have a blurred vision. Patient has an headache. Patient has an vertigo, and patients may has an confusion or the balance impairment due to the ear problem. Now, we come to what are that vestibular rehabilitation. Vestibular rehabilitation, known as VRT. VRT is a specialized form of the therapy that intended to alleviate vertigo, dizziness, gaze instability, or further to improve balance. So, what are the goals of that vestibular rehabilitation therapy? It is used a problem-oriented approach to promote a compensation. As I told earlier, that VRT is based upon that neuroplasticity, that helps to promote compensation by doing the adaptation of the brain. Now, what are the exercises? What are the exercise protocol that we are giving? That protocols are customized. They are not the standard protocols, but we have to customize that protocol based upon the condition of the patient. So, in that we have gaze stability exercises and gait stability exercises, because patient has a blurred vision. Vertigo patient has a blurred vision, so we'll prescribe only a gaze stabilization exercises. But later patient has a balance problem or the gait problem, so in that case we prescribe a gait stability exercises. So we'll discuss today's session, that is gaze stability exercises. So first exercises that include in that gaze stability exercises is gaze stabilization or adaptation exercises based upon the vestibulo-ocular reflex stimulating exercises. So first we'll consider gaze stabilization. What to do in that exercise is that we ask the patient to look at the straight level and focus the vision at one particular level. Then turn the head 45 degree towards the right, and then again ask the patient to turn the head 45 degree towards the left side. In that exercises, we ask the patient to look straight or maintain a vision or focus a vision at one particular level. Now, second form of exercises is head-eye coordination. Initially, head-eye coordination in same direction, but when patient expertise in that exercises, then we shift the patient to the head-eye in opposite direction. So first, we give the head-eye coordination exercises in same direction. So what to do? In that, we are holding a target, keeping eye on the target, and slowly move the target side to side while moving the head initially in same direction of the target, but later on the opposite side of the target. We give that exercises to 10 to 15 seconds and perform in a sitting position, and repeat that session at least 3 times per day, and do that session in the repetition of 5 to 6 repetition in 3 times a day, and repeat that target on pattern background as well. So I repeat that we must holding a target first, then keep eye on the target and slowly move the target side to side while moving ahead in opposite direction of the target for few seconds, and that exercise is performed in the sitting position. Initially head-eye coordination in same direction as the target moves, and but later head-eye coordination in the opposite direction. Now next exercise is oculomotor exercises, that are smooth pursuit and the scaled latency. Smooth pursuit is nothing but the visual tracking exercises, and when we enhance that visual tracking exercises, we proceed the exercises or we shift the patient to the scaled latency to increase the speed of the patient, speed of the exercises. So what are that visual tracking? In that we ask the patient to focus a target, focus a vision on a one particular target, and then move the target, and simultaneously we ask the patient to move the eyeball toward the target, and that condition, that type of exercise is known as the visual tracking exercises. It is always known as that smooth pursuit exercise. Now when we increase the latency or the speed of that particular exercises, then we keep the target in both the hands, then ask the patient to switch the or to look forward on the target and focus the vision on that particular target, then initially towards the right side with the movement of the target, and then to the lateral side. So these are the two important oculomotor exercises. One is the smooth pursuit and other is the scaled latency. Thank you so much. Thank you for giving a valuable time. Thank you so much.